We're doing something a little bit different today, okay? Where bold ideas, powerful voices, and culture converge to reimagine health for us. That is the bridge. This is gonna be a great conversation. I'm very, very excited for it. Just one funny joke. I've been chasing Vanessa for like 4 years now, so I'm really excited to have you here. No shade. I know
I have a lot of behavior.
You've been doing a lot. Okay. You've been building an amazing company, extremely busy, so it's really excited to have you here. And I'm really, really grateful for this conversation. So you didn't start in nutrition, right? History, then marketing. What were you actually searching for during that time before you came into healthcare?
The best GPA, the easiest, I thought, major to get the best GPA, so that when I did pick a grad thing to go to, I would have good grades. But the history was not easy. I had to read like 1,000 pages a week. I had to write many papers. I'm very good at disseminating, like reading through information, getting what I need to get through. So that was good. But yeah, that was the only reason. I studied history, wars, and history of the church. So if anyone has questions, I have them in my brain. Yes, I can help all of your kids make notes, and 6th grade social studies is where I excel.
All right, and then you walk into a dietitian's office one day and looked around and said, where are the people who look like me? Which I think is often what we feel like, right, when we walk into the spaces that we're in. But walk us through that moment.
Okay, so we are Haitian, and I don't know the narrative about immigrants. We are very special, no shade, I'm just saying the facts. And my mother was folding my clothes, and the day that I was leaving for college, and I used to call my parents and be like, I don't know what they're feeding people here, but I'm not eating it. My roommate tried to make me, mac and cheese in a crock pot, and I was like, oh my God, your mother does not love you. And my parents would drive to Fordham, and they would bring me food, like like rice and beans. If somebody wants to make me banan perze, I haven't had in a long time. My mother is like off of it, and I'm so sad. But I would have that, but I did not know anything about food. I woke up, I went to school, I came home, and there was food. And my parents talk about this all the time, being in Haiti, like abject poverty and wealth and opulence are right next door to each other. So you could be going to school with a driver and have somebody doesn't have shoes and doesn't have food. And so the fact that my mother could drive down the street and buy groceries for her family and make food every day is this prideful thing. I didn't understand that then, and I couldn't articulate that. But I'd be like, can you just be like my white friends and have pizza on Friday? And they'd be like, no. So then I got to Fordham in the Bronx, and I was like, well, hot damn, I'm gonna eat all the pizza I want. And I did. And then I gained 50 pounds. And then I moved home, as a good Haitian girl does before she gets married. And I didn't have to pay rent, and I lost 50 pounds. And I was really curious about that. So I was like, oh, I wonder what I should do. And I had in my mind, like, oh, I should talk to a dietitian. I didn't know really what a dietitian did per se, but I felt like those people went to school. So I went into a dietitian's office, Carrie Glassman, and very pragmatically, she just talked to me about food and how to eat food. And she didn't take anything away from me. And I was like, girl, I eat rice and beans every day. And she was like, you can. This is how you do it. And I was like, wow, how amazing. She didn't shame me. She didn't question what I was eating. She just taught me how to do it. And then when I started to dig deeper, I learned it was medicine adjacent, and she did her internship in a hospital. And I was like, oh, that sounds pretty fun and energizing. Maybe I'm gonna do that. So I applied and I got in. And my whole goal was to just be next to doctors and learn, because I have never been more energized in my life than to be at Mount Sinai Hospital, to be in the ICU, for them not to round until I walk in, for them to call me and say, yo, you want to pull this OG tube out and then drop this NG tube and try this core track system? Or like, oh girl, this guy, his vocal cords are exposed. Do you want to see? I'm like, yes. And we made no money, but there was camaraderie, and I learned about medicine. Food is the layer on top, whatever. And I learned how to interact with people, because I had to tell heads of state, celebrities, princes of different countries, and the guy who lived in the housing project across the street the same information. So it was a skill that I learned, and I just thought it was so fun and interesting, and that's why I did it.
That's amazing. So you brought this up. You said, we're both Haitian. So tout haïtien, ça qu'a fait.
Ça passé.
But how does that, and like you said, there's always rice and beans at the house. So how does that show up in how you actually counsel patients? How did it shape how you built Culina Health?
Yeah, I worked on every service at Sinai. I think it's important to work on all services, right? Because then you can really know. And I'm Haitian, so of course I am culturally competent. And so I walk in, this guy, he's from Bangladesh, he just has a kidney transplant, and he's like, yeah, so I eat grilled grapefruit every day, and I am aghast. I'm like, well, you just can't. And he's like 67 years old, and he's like, no, you don't understand, that's what I eat every day. And I'm like, well, you can't, because then it's gonna increase the prograph, and then it's gonna be toxic, and you can't have it. And he's like, no. And I was just like, what? And then the pharmacists were like, well, just adjust the dose, you idiot. I was like, oh, okay. But that actually opened my eyes to something, right? I was like, oh, wow. Like, here I am, somebody whose culture is very important to her, who right now in Nyack, my mother maybe made you shepherd's pie, which I think is so gross, but there's always rice and beans, because if I show up, I'm not eating the shepherd's pie. So there's rice and beans every day. That's what I eat. So how am I going to tell this guy you can't have it, right? And so then I thought, how many people are afraid to go to a dietitian or afraid to go to the doctor? And then I started to dive into that, right? And then we see how many people, right? White women are diagnosed with breast cancer twice as much as black women, but black women die twice as much because they don't finish treatment, because they don't feel seen or heard. And I have spent a lot of my life not being seen or heard, even though I have the receipts. So it's like, hey, what can I do to make sure people are seen and heard? So that's it. We did not come to make $1 billion business. I do have competitors that are claiming to be worth $1 billion. I don't know how that's possible for fee for service for nutrition, but that's a different panel. However, right, it's like, that's not what we're here for. We're here to just give people good care, coordinate that care, show people that dietitians are actually the front line of healthcare. We are highly trained and underutilized, and people should know that. So if anyone's gonna change healthcare, I promise you it's gonna be me.
I love that. I love the energy there. So, you were at NYU, stable and respected. What finally made you bet on yourself?
You mean like start Culina?
Yes.
Nothing was happening at NYU. You have a whole department of nutrition and no one's doing research, and you have people that are running a department who are telling people what to do but haven't been in a hospital since the 80s. And I actually created Culina in my mind during COVID, because it was difficult to get these interns trained. Many notable dietitians have come out of NYU. So I said, let's get an NPI number. Let's do something good for the community. Let's get all those really fancy RDs back in here. Let's triple the amount of dietetic interns that you take in, and only send them out to, their specialty rotations, ICU, transplant, et cetera. And they were like, you don't understand how to grow a private practice. And I was like, guys, that's not the thing to say to me. So then I was like, all right, great, let's go do it myself. And that's what happened.
I love it. So let's keep talking about building this 20 million company that's backed by $20 million raised. What did the journey really look like? So you made the decision to move forward. You decided to go against what people were telling you that they said you couldn't do. Tell us about that journey.
It really was pretty serendipitous. Tamar is my co-founder. She is one of the smartest dietitians I know. She has a lot of empathy. She knows a lot about supplements. It's really weird. And she wanted to meet for a coffee, and then said, I don't like working by myself, so let's work together. So we hired 2 dietitians. One is one of my best friends from high school that I met on the first day of 9th grade, and another one of my best students. So we'd see patients in New York and patients in New Jersey. And then COVID happened. And then it was the first time that a telemedicine visit was being reimbursed at the same rate as an in-office visit. So it's 6 dietitians, all working part-time. I was not taking any salary. Any money I made, I put back into the business. We made $934,000 with no marketing, and then VCs started to call.
Wow. So I think, first of all, give that a round of applause. And this is something that we talk about within the community a lot, right? There's so many things changing in the landscape of healthcare, and we all have an opportunity to insert ourselves and build something new. So yes, we have been trained within these institutions, but what can we create for ourselves, right? And it's amazing to see examples of that. So you said the VC started calling, so I think you may have the answer to my next question already. What was harder, getting your first yes or proving that you deserve to keep going?
Getting the first yes. And actually like understanding the game. It can be really personal, especially I'm a woman. I'm a woman of color. My parents are from the poorest country in the Western Hemisphere. It's the intersectionality of race. White men hold all the dollars and they don't see me. They see white women in their living room, in their kitchen. They see black men in the locker room. They don't see me. My parents love me. I went to Europe every summer. I speak French. I all of the things. I went to the all-girls school. So now I'm sitting here talking and everybody was like, who is this girl? And they would just kick me out. And I would take it like, you're so racist. And then somebody gave me a lesson, the person that wrote me the first check, who actually went to Fordham. He was a year behind me. And he said, I can only do 10 deals a year. So why am I gonna give it to you? You have to walk in here thinking I'm going to say no. And I was like, oh, okay. He's like, so then you've gotta listen for the opening for me to say yes. I was like, all right, great. Boom. That's how he started the conversation. And he's like, I'm gonna write you a check. I'm gonna lead this round. He did not write me the biggest check, but I will be forever indebted. And I'll always say their names, Charlie O'Donnell, Brooklyn Bridge Ventures. He does not he doesn't have a fund anymore, but he will coach you if you wanna learn how to fundraise or whatever. And that really helped me. So then it was like, oh no, this is me practicing my pitch. This is me honing my skill. This is me toughening my skin to understand this game. That is all it is. And so I never went into any meeting that anyone would say yes to me. And also my business had legs. My business made money. So I actually only needed a little money because insurance companies are tricky, as we all know, and they would hold money, and then I was paying people's payroll, and that I wasn't looking for millions and millions of dollars. I was just looking for that little bridge to give me a little rest so that I could figure out what the next phase of the business would be.
All right, that's amazing. So, now that you have raised all this money, how do you balance investor expectations with an equity-driven mission?
We always beefing. They're like, this person is worth $1 billion. I'm like, this person has a class action lawsuit. And if this thing burns to the ground, all I have is my license and my integrity. And I'm the only one with a payer on the cap table. I'm the only one that's giving nutrition services to the payer's payvider. I'm the only one inking health system deals. I am the only one that 54% of her business comes from One Medical. I have an Amazon health benefits connector in July. You will go onto Amazon and you will be able to log into Culina. I have done that because I do things the right way. So you can be on my back all you want, but I'm here protecting your investment, and I also have to protect myself. And if at whatever stage in this game you don't think I'm the right one to take it to the end, thank you so much. Send me on my way. I'm very happy to make lunch for my kids and walk my dog. No problem. So there is no emotion here. It's for the good of the business and for the good of like the world at large. That is the work that we're doing.
I love that. That's amazing. So you built Culina Health around clinical outcomes. What does poor nutrition actually do to the body? And why is something as basic as access to fresh produce still a barrier for so many of our communities?
Because we need expansion on nutrition coverage, right? Like I said, we're highly trained, underutilized. We are the quarterback. We help outcomes, increase all of our outcomes. We perform 50% better than benchmark as it relates to weight loss, statistically significant, 5 to 10% in 3 to 6 months. The reduction of LDL, which is the predictor of stroke and heart attack. Blood pressure, we took 50 patients, followed them for 1 year. They all were pre-diabetic. We reversed all their pre-diabetes, which is savings, if we extrapolate that out, like $10 billion to the system. Anecdotally, we know that the payer is looking for $2,500 of savings, and we're doing $7,000, right? So like, we need to expand coverage. And also, we pay lobbyists. Our governing body does not protect our license, and they actually exploit the profession, and it's really terrible. And I've actually called them and they were like, yeah, you should pay for lobbyists. And I'm like, it's so weird because that's what the governing body is supposed to do, but okay, I'll play ball. And so I have met with all of MAHA, Republican chairs, Democratic chairs. These people are very disconnected, but it's not their fault because they don't understand, because our governing body isn't doing their job. So I actually went to the Hill probably like a month ago, and I talked to both the Republican chair and the Democratic chair, and they talk out of both sides of their mouths. We want a reduction in the total cost of care, and look how great Mark Hyman is. I promise you, ask my chief of staff. I stood right there and I was like, first of all, you have put $2.6 billion in Mark Hyman's hands. Mark Hyman hasn't seen a patient using their insurance in 25 years. And you want to put a patient in front of me and Mark Hyman, I'm going to get to the answer faster with using insurance. This guy was like, does anyone ever go against you? I'm like, not really, because I have the answers. And he was like, what do you want? I go, next time you invite Mark Hyman to speak on behalf of all Americans, you should also invite me, because I am reflective of Gen Pop. And I'm not talking about people on Medicaid and Medicare, although we can also have that conversation. I am talking about regular people who you think should hire chefs. That is very disconnected. And the job of the dietitian, right? At Mount Sinai, from May to October, you can use your SNAP benefits and get organic produce. That's my job. How much money do you have at the end of the week? Where do you live? I will help you get that access. And it's okay if you live in a rural place or in a food desert. It's okay for you to have Yoplait yogurt, because you don't have access to Siggy's or Faye, and that's not in your flavor profile. So we have to get you to a point. And would I rather you have yogurt or like soda and Snickers, right? Let's also reduce that elitism. So stop following all these, my daughter comes home from school and I make chia seed cookies with almond flour. Your daughter hates you. Your daughter wants to have Oreos. Stop it. Also we're getting rid of red dye 40. How much Gatorade are your kids drinking? How many Skittles are your kids eating? You know what would help you? Education. We need to expand the education. That's all you have to do. If you sit with me for an hour, I am going to help you, and you might never have to see me again, and I probably will give you, if you're high literacy, all that you need. And if you're low literacy, then maybe you're gonna meet me 12 times, and then you're gonna come back the next year for 6 times. And that's okay, because you all have this benefit, guys. 93% of my patients exercise their insurance benefits. Wow. So it's education, you just don't know, and I'm not taking anything away from you, I promise.
That's amazing, that's amazing. So when you think about access, who is most underserved right now?
Honestly, I think it's like kids. Honestly, kids are not being, parents are distracted. They don't understand. They don't know where to get things. Kids are at school. People are just throwing food in their faces so that they can be quiet. Nobody is spending time. They think that it requires this 35 ingredient list recipe. And you can also have convenience foods. So I think that children are being underserved, because when you don't start when they're small, then the bad habits continue. Not bad, but these habits continue as you grow and you don't know what's what. So if you just start with that, probably gonna be better off, healthier people.
I love that. All right, that's a great answer.
And also, not everything has to be quick. My mother is 75 years old and smokes cigarettes, and literally nothing wrong with her, because there's no plastic in their house. And I think they maybe only use their dishwasher 10 times in my whole life. You don't have to be looking for everything to be fast.
That's true. That's true. I need to get better at that.
Yes.
I need to get better at that myself. You've spent your career proving that when people are truly seen in their culture, in their kitchen, in their community, they heal differently. If this room walked away and did one thing to close the gap, what would you want it to be?
When someone is different than you, when you don't like what they're saying, when they're your op, as the kids say, ask them more questions. Why do you think that way? The truth is not on the right side or the left side. The truth is generally in the middle. So open your ears a little bit more, guys, and stop being so self-righteous. If I'm different than you, then I want to lean in more. And I think that's why I've gotten to this place, because the more that I don't understand, the more that I ask questions, so that I can understand whatever it is that you're going through, or what you're dealing with, or what your point of view is. And I can stand here and say that I am a very excellent clinician because of that.
Healthcare is a team sport, right? And I think even amongst each other, we can learn a lot, no matter what part of healthcare you're in. So the amazing part about being in a room like this is that you have people from the entire healthcare ecosystem, pharmacists, nurses, administrators, all right, nutritionists, dietitians, people in all different parts of the space, and we all have a lot that we can learn from one another in terms of how do we can take better care of our patients and impact health outcomes and health equity. So I love that. That was our last of the interview questions. We're gonna go into some rapid fire questions that I did not send you in advance, by the way, so these are gonna be fun.
Okay, good.
All right, so first one is under people. When you say us, who are you building for?
Us first, them second.
All right.
Always.
Power. All right, so what do you wish you had the power to fix tomorrow? Like with the snap of your finger.
Yo, you know what? To just be in my power. Like, be in your damn power. You don't have to answer to anybody. I think that is the thing. You're always trying, you don't have to be small. I wish I could fix that everybody could just stand in who they are and believe in themselves and not look outside. It's always inside.
That was a powerful statement right there.
Mm-hmm.
All right, health. What is the most urgent shift needed right now?
Guys, I don't know the answer. I don't drink alcohol. I eat vegetables. I feel guilty if I don't eat them, and I got cancer. I think the food is the problem. Like, we need better food. We need better food.
All right. Culture.
Also, y'all need to stop drinking so much. So put it out there. I'm gonna put that out there. It's like y'all watch too much Sex in the City. They were out there having their cosmos with their girlfriends, and here we are. You don't need to be drinking that much. It's not good. Go.
To the manager of this venue, I am sorry that was not.
I'm sorry. It's fine. We're here. We're all here drinking.
No, I'm playing.
Yeah.
So,
3 minutes.
now, all right, two more questions.
Got it.
Culture. What does doing it for the culture actually mean to you?
I've got half Italian kids. Ask them right now what they are. They'll tell you to your face they're black. I did it for the culture. They know exactly who they are. Know who you are. Say that you're black. Say it with your whole chest. Say that you're Haitian. We are very special. I am not afraid to say it. I say it all the time. Period.
Love it. All right. And connection. So if there was any partnership that you can unlock that'll help you get to the next level, what would that be? Because they might be in this room. You never know.
Guys, don't get distracted because somebody has 5,000 dietitians and I only have 90. They're not all, trust me, you're going to send me your patients and I'm going to see all of them. So that.
So what partnership would you want to unlock? Is there one, tell me one partnership. Is it with?
Any digital health company that's, selling whatever they're selling. I can do it all.
Okay, I love it. Very, very confident. I love that. Let's give Vanessa a round of applause.
Nice to see you. Wow.
But no, thank you so much for being here.
Oh my God, thank you. You're an angel.
No, you are a representation of why we're building this room.
Very
right?
nice
How
to be
can
here.
we inspire each other to do amazing things, take the path unseen, and build the bridge to what's next? So thank you again. Appreciate you so much. All right. So that was the Bridge Live. I hope you all enjoyed that. And if you did, we'll probably try and do it again. So if you enjoyed it, just give me a round of applause, please. All right, again, huge thank you to Walmart for supporting us tonight.
Thank you, Walmart.
And if you want to see this full episode, it'll be up on our YouTube page, and eventually you can see a lot more episodes like this, whether live and in person at a mixer or in a different space. So thank you all for being here.